Thank you very much for the very nice introduction, and thanks everybody for coming on this a beautiful day. So I just wanted to start with, as we mentioned, a brief talk on low back pain and some of the options that are out there, and then we'll open it up to questions afterwards.
Can you see my screen?
Yes.
Okay, perfect.
All right, so we're gonna, even though I'm a surgeon, we're gonna give a overview of everything that's available out there, especially at a spine surgery, comprehensive spine program, such as the Lower Manhattan program, as well as the Uptown Weill Cornell program. And so this is gonna be an overview of pain management, as well as rehab medicine, as well as some surgical options should you actually need them in the future. Next, please.
Okay. Doesn't want to advance. Here we go.
So there's a lot of people on this call, and you know everybody thinks they may be the only one with back pain, but it's pretty common. And as we get older, it's more and more common. And 1 out of 5 people at any time will be suffering from significant chronic back pain. So you're definitely not alone. And the process that you're going through, we're happy to help you with. Next, please. And believe it or not, it's getting worse in this current environment with the lockdowns, with our decrease in activities. A lot of us are more sedentary. We're definitely eating more, putting on weight, which is not helping. The gyms are closed. If we're working at home, we may have a bad work environment. And so, and then there's a lot of stress, which has overlaid everything, which adds to the increase in amount of pain that you may be suffering. Next, please. So it can be quite overwhelming to seek help and find the right treatment. People will talk to you about chiropractors. They'll talk to you about massage. Next, please. They'll talk to you about acupuncture. Next, please. They'll talk to you about, some people will go to cognitive behavioral therapy to help with their pain. Next, please. And then finally, there's an array of medical doctors, which always seem to be at a tug of war of how best to treat your pain. And all of these have some benefit to different patients, and all of them have value if they make you feel better. But navigating this array of your treatment choices can be difficult. So next, please. I always recommend approaching your pain as if I were the patient, because at one point I was the patient. I did have chronic back and neck pain when I was a little bit younger. I was definitely more sedentary and did not have an active, healthy lifestyle. So I started changing that by identifying what my symptoms were. I went to physical therapy, started Pilates. I did wellness, weight loss. And at one point it was so bad I considered pain management. But overall, with a change in lifestyle and change in activity, I was able to recently complete a, next please, an Ironman triathlon despite having significant pain. So the first thing I do, and next please, is tell people to try and step back and understand and describe your symptoms. The number one complaint I hear is that it hurts everywhere. And I definitely agree that this is true. And if you're feeling it, I really sympathize with what you're going through. But if we can get into the details, it helps both you and your physician identify what may be helping you. You want to know or what may be hurting you and how we can fix it in an appropriate way. So you want to document when it hurts, what makes it worse, what may make it better, and then put down what you've tried before. And actually writing this down can be helpful. I've listed a little bit of a pain diary here. Because oftentimes we remember things that are only the worst or the best, and we don't really get an idea of the details in between. And this is actually quite helpful because it will help you differentiate back pain, because back pain can have many causes. It can be muscle pain due to muscle spasms. It can be joint pains due to the joints in your lower back. It can be nerve pains due to a compressed nerve from a disc herniation. Or it could be a sacroiliac pain or a pelvic pain that translates into your lower back. So getting an idea of your symptoms can help start to narrow this down to what you're actually feeling. Next, please. And the best treatment may be lifestyle change. You may not need to go to have a surgery. You may want to start with something easier. Actually, healthy diet, it may sound like, well, what is that? How's that going to really help your back? Well, if you have a diet that promotes your bone health, that's very important. If you have a diet that works for your heart health, that actually works for the muscles in your lower back, because much like your heart, the muscles in your lower back rely on an appropriate amount of electrolytes. And so if you have a good diet, the chance of you having a muscle spasm is a lot less. If you have a good diet, you also lose weight, and this puts less pressure on your lower back. Next, please. If you increase your activity, that can definitely improve your overall health. Just increasing your activity can increase the amount of endorphins you feel, decrease the pain, and it can also basically foster weight loss, which then also helps take off the pressure on the lower back. And then finally, if you're working in an office, which a lot of people do, or if you're at home doing office work at home, you can take these simple steps to make it better for yourself. Work on your ergonomics. Make sure you're sitting appropriately. Make sure your chair is functional. Make sure you're sitting at the right angle for your hips, your knees, your elbows, your arms. Make sure your monitor is at the right level for your neck. All these small things really add up to a decrease in pain over time, which can really improve how you feel. Next, please. And then finally, you have to realize that you have to take care of the muscles in your back, just like you take care of the muscles in your arms, your legs, and everywhere else. Because your back is really full of muscles, starting at the top with your trapezius, ending at the bottom with your erector spinae. These basically keep you upright during the whole day. They're big, powerful muscles. And if you take care of them, you're likely to have less pain. Next, please. But if that's not enough, then the next step is to see your primary care doctor. Get an overall health check. This is actually more important than you may think, because when you see your regular doctor, you may find out you may have a medical condition which influences your back pain or exacerbates your back pain, makes it worse. They'll also help you rule out red flags. If you're losing a lot of weight and you're having back pain, that may be a sign of a serious medical condition. If you have fevers or night sweats, all those are very important things to have checked out. And then, they'll help you decide on what your next steps are. Often it'll be to start a round of physical therapy to see if that helps you feel better. And they may help you decide on what type of pictures you may need, x-rays, MRIs, and the like. Next, please. So the next step is often a radiological evaluation. We want to know what's going on inside, and we use that information along with your symptoms to help identify what may be causing your problems. So often you could get an x-ray. Next, please. And this is very good at showing your overall spine health, if there's any misalignments, any scoliosis. Next, please. Some people get a CT scan. This is good for if you have a potential fracture. Next, please. But the most common that people get is an MRI, and this helps with the soft tissues as well as the bones, shows the discs. It also shows the ligaments, and it will show any compression of nerves. Next, please. So then once you've gotten all of that and your doctor feels that you may need a referral, you enter the tug of war of which doctor you see. And I will tell you that it really is not important to pick what you think is the right specialty, because all of these specialties may help you depending on what your problem is. And so it's good to go to a practice or a spine program specifically like we have that has all of these aspects in one. And that would include physiatry, which is rehab medicine, which focuses on physical means to improve your health, as well as pain management, which focuses on smaller interventions which may relieve pain and allow healing. And then finally, you may need a surgical intervention which would correct an anatomical issue which is causing your pain. Next, please. So rehabilitation treatments are very important. I really believe in them as a first step to try to get yourself better. These are definitely less invasive. They do require some effort and time, but are quite effective for most patients that undergo them. Next, please. And then pain management treatments are sort of the next step if the physical therapy doesn't work. And these are smaller procedures which may be done to help relieve pain in a certain area and get you able to be more mobile and active and participate with the physical therapy. And then next, please. And then finally, if those don't work, there may be a need for surgical intervention, and that could be related to a compressed nerve. It could be related to a instability or severe arthritis, a fracture. All of those can be treated surgically and can help improve your back pain. Next, please. So the first step in the process, to get a little bit more in depth, is physical therapy. And a lot of patients will say, well, why should I try physical therapy? What's it going to do for me? And some people are more gung-ho. Most people are in the middle. But if you understand what physical therapy can do for you, then if you have an idea of why you're going, I think it will help you get more out of it. And so the number one goal of physical therapy is to try to correct any imbalances or difficulties with your muscles or ligaments that have occurred over time with your activity or lack of activity, or your current job or exercise program. And so what they do is they try to rehabilitate muscle strains and sprains, and as well as build core strength. And that's really important for the lower back, is strengthening the stomach muscles, the obliques, as well as strengthening the muscles that we showed earlier, the erector spinae of the lower back, because all those, when you build a strong center, will help decrease the pain that you may occur. And also, if you decrease the amount of lower abdominal fat and take away some of the pressure there, you actually open up the spine internally, and that can take pressure off nerves. So there is a real rationale for undergoing this. And if you participate and you have a good result, it can be quite helpful. And then finally, if you're having extremity pain along with your back pain, these interventions with the therapist can sometimes help strengthen the support muscles so that you're able to function despite having some nerve pain, and hopefully temporize that so your body will heal. Next, please. Non-operative interventions or pain management interventions tend to focus on making your symptoms better, trying to decrease your pain, either so you can go about your daily activities or so you can participate more robustly in physical therapy. They're also designed to decrease your inflammation. Part of the pain that people feel is inflammation around nerves, and these interventions are designed to decrease that inflammation and make your body have time to heal itself. And basically, the goal is, if you take away your pain and give yourself time to heal without pain, oftentimes your body can correct small problems without the need for a more aggressive intervention. Next, please. So one of the most common ones, which probably many of you have heard of, is an epidural injection. And this is where a pain management doctor or a rehab doctor will introduce a needle into the epidural space. As you can see here with the needle, that's basically in the space that's between the bone or your spinous process and the covering of the nerves. And then they will inject a medication. Often it's a steroid medication, and this decreases the inflammation around the nerves. And this usually results in a decrease in amount of pain over time as the inflammation recedes. These can be temporary, but these can also be long-lasting if the inflammation as it recedes doesn't recur. And so these are often good interventions to help you feel better, get about yourself, and be more active. Next slide, please. Oftentimes you may see a pain doctor, and they'll often recommend a facet treatment. This is a little bit different because they are basically, here we're fighting the arthritis in your back. And what you do have in your back is many joints up and down your spine connecting each level. And these are similar joints to like your knee joint or your elbow joint, but much smaller, and they move in a different way. And when they have significant arthritis, they can be quite painful. And so one of the things that can make you feel better, especially if you have low back pain due to this arthritis, is to have a facet treatment. And what happens is the pain management doctor will place an electrode near the joint, and then he or she will cauterize the nerves, which then usually results in a decreased amount of pain due to your arthritis. Next, please. Sometimes, a pain intervention will be a way which is a little bit more high tech, is to place a device which basically will trick your body into not feeling the pain. And this can be, which is on the left side, a spinal cord stimulator, which is basically a paddle that goes in, sends little electro pulses to your spinal cord. And what this does is it prevents pain from coming from your lower extremities through the spinal cord into your brain where it's processed. And so this can be quite effective in certain patients who may not be a candidate for other interventions or may have failed some of the less aggressive interventions. And on the right side is a more novel technique, which is called a dorsal root ganglion stimulator. And these stimulators basically stop the pain from a specific site as it comes into the nerve root. And these are quite good if you have a specific pain due to a specific nerve root, or you may have a pain that is mediated by the nerves, but there's no longer a structural issue in the lower back. Next, please. And then, one of the things you may find is that you've tried all of this. You've seen your physical therapist. You've worked for 6 weeks, maybe 2 months. You've seen your pain management doctor. You've tried several interventions, or you've seen your rehab doctor. You've tried some interventions, and it still doesn't work. Or you have significant pain that may not be right to try those other interventions. Then you would come for an evaluation to see if surgery for your back pain would help. And surgery, it's really designed to relieve back pain by several certain techniques. To break it down and make it simpler. First, we try to remove compression from the nerves. Whereas the pain doctors will try to decrease the inflammation with medication, we try to decrease the inflammation by removing the pressure. This could be a herniated disc. This could be lumbar stenosis, which is due to increased arthritis. We also try to correct structural defects. And this could be due to long-standing stress fractures. This could be to significant arthritis, which results in problems of the alignment of your spine. This can be due to long-standing factors such as scoliosis, which may have been present since you were a young adult. And really, the great part about surgery is in the last 5 years, and really over the last 10 years, there's been a lot of less invasive techniques developed, which result in improved healing times, decreased amount of post-operative issues, and really takes advantage of the advanced technology that's out there in order to provide better outcomes. Next, please. So again, this is just indicating about removing compression from the nerves. This could be a disc herniation, as circled here, which could press on a nerve and cause pain. Next, please. This again is a structural defect where one of the vertebrae is not aligned with the next. Next, please. And then finally, again, a more aggressive deformity such as the scoliosis. Next, please. So first off, the most simplest form of surgery is a decompression. And this is basically the attempt by a surgeon to help your back pain by removing the pressure on the nerves. And I put a diagram here of how it's often done lately, which is through a minimally invasive approach through a small retractor, which doesn't require a lot of muscle dissection. And then the goal is to remove the bone and ligament, which is pressing on the nerves, and make more room and allow your body time to heal. On the right side, we have a minimally invasive decompression where we remove bone and ligament around the joint, which may be compressing a nerve as it extends out and goes and forms the major nerves of your leg. Next slide, please. We've also come up with advances for spinal fusion. This diagram here shows your options that you may have for fusing a unstable spine with some of the most novel techniques. These include anterior approach, which is at the very bottom, a posterior approach, which is the second one up, and then finally a lateral approach, which is the third one up. And these show how we can address unstable spine or a severely degenerative disc. And these advanced techniques allow for a fusion with a lot less surgery than it was in the past. And all of these techniques can be done in a minimally invasive way. Next slide, please. And then, you know, one of the things that is out there and then is becoming more and more recognized as one of these sort of previously unrecognized causes of back pain is the sacroiliac joint. A lot of people will focus on the muscles, will focus on the joints of the lower back, will focus on the discs of the lower back, and sometimes those don't have the reason for the problem that you're suffering. And so one of the things that is becoming more and more recognized is that the joint between your sacrum, which is the bottom of your spine, and the iliac wing of your pelvis can cause pain if there's any instability. And this can result in low back pain as demonstrated here, with some minor symptoms in the leg, often attributable to that, as well as some groin pain, which can be common. Now, not every patient with sacroiliac pain will have all of these, but these can be due to a sacroiliac issue. And this can also be quite a good thing to look at, especially if you've had an MRI that is negative for any significant problems. And so it's readily treatable, either through pain management techniques or through an extremely minimally invasive approach as shown here, where through a small, basically 1-inch incision, you can place several devices to stabilize the joint and decrease pain. Next, please. And then another thing that can come if you have poor bone health, or if you have prior history of osteoporosis, a lot of back pain can come from fractures. And these are compression fractures, which I've shown here on the right. And one of the ways we've been treating this more advanced is by basically a vertebroplasty. And this is a procedure that's been done for a while, but as this picture on the left shows, we've used advanced techniques such as navigation to be able to accurately place the needle and have a very good fill rate in order to decrease the pain and release the pressure on the end plates. This could be a good operation if you have a compression fracture as a source of your pain, and should be something that you consider discussing with your doctor. Next, please. And then finally, the last step is for more aggressive spinal reconstructions. And this is for when you have a very severe problem as the source of your lower back pain. If you look at the on the left, we have somebody here who has a deformity of scoliosis, and this results in low back pain, but also results in compression of the nerves due to the change in the anatomy because of this curvature. And so after trying and failing other processes such as therapies and pain management, this patient was treated with a minimally invasive approach, which includes a very advanced intraoperative technology, which is in the upper left corner, including intraoperative CT and navigation. This navigation is also shown next to it with how we plan to put the screws in, and then the overall ability to have an advanced reconstruction on the screen during these procedures on the bottom left. On the bottom right, this shows the size of the incision to be able to do an operation of this size, which really allows for quicker healing, shorter hospital times, and a quicker return to activity. Next, please. So I wanted to summarize with some takeaway points that, number one, back pain may have many causes, and it can be quite frustrating to navigate what may be the source of your pain. And so taking control of your symptoms by writing a detailed diary and understanding them is the first step in sort of taking that path to getting better. And will give you the ability to have a better conversation with your doctors regarding what may be causing it, and help you obtain a more accurate diagnosis and treatment plan. And then there are a lot of newer techniques out there and less invasive techniques, both in the pain management world as well as the surgical world, which help patients with these symptoms. So I'd like to thank everybody for coming and open it up for questions.
Thank you, Dr. Fu, for that informative presentation. And so I would like to just remind the audience here to please refrain from any personal questions. I have been taking your questions during the presentation, and we're going to start with the first one, but if you have additional questions, please type them in the chat box and we will get to them. So Dr. Fu, the first question that we have is from Cora, and the question is there anything that can be done for scoliosis?
Yes, that's a great question. Scoliosis can mean a lot of things. So again, it depends on what your individual situation is like. But in general, we like to start with a program of therapies, usually in the physical therapy sort of regimen to increase your muscular strength and help build up your overall reserves in your lower back. And then we transition, if that doesn't work well enough, to trying different pain management techniques to decrease the pain. Maybe that could be related to some of the pressure on your joints from having an alignment that's not optimized. So those are the first two treatments that most people go through. And then finally, if it's significant enough or severe enough and it really affects your quality of life, then surgery is an option down the line for reconstruction and realignment.
Thank you for that. The next question we have comes from Corey, and the question is, as an alternative to surgery, what are your thoughts on regenerative medicine, such as PRP or stem cell therapy?
Yeah, that's a great question. Now, I did not include those therapies in this talk, and mostly because these, even though quite popular among certain people, are not yet proven or FDA approved for treatment. Now, that doesn't mean that they may not be beneficial or they may not help you, but there's just really not enough data out there for me to promote them as a treatment. But the goal of these treatments is to help your body replenish your connective tissue. So if it's injected into your disc, it's to help your disc sort of regenerate and sort of ideally walk back the clock of age. Because as we age, the water from our disc diminishes, and then our discs sort of dry out to be sort of pejorative about it, and then this results in progressive degeneration. So the idea is if we can arrest that by putting in a medication or the patient's own plasma-rich protein, platelet-rich plasma, then that can help the pain. Again, it's still, even though it's been around for a while, in the early stages of being studied.
Great, thank you for that, Dr. Fu. The next question comes from Deborah, and the question is the facet treatment the same as radiofrequency ablation? So
yes, it's often called radiofrequency ablation or RFA. You may have heard that term, that as a short term that's told you by perhaps your pain doctor or your rehab doctor. And that's one way of performing an ablation or treating these nerves on the facet joints. And that works by putting radio frequency in and burning the nerves by this increased frequency. And it's very focused and very safe. Other ways include what we call basically thermal cautery, which is basically a more physical way of burning the nerves with heat. And then finally, there's some medications that can be injected, which can affect pain relief by calming those nerves as well. But radiofrequency ablation, RFA, is the most common way, I think, currently that those are treated.
Thank you. And we have a similar question. Elaborate, what are your thoughts about ablation? Also, how often can you do an ablation?
So I apologize. I think you froze up for a second. Do you mind repeating the question?
Apologies about that. Can you hear me now?
Yes, yes.
Okay, excellent. So this question is similar in regards to ablation from Arthur. It is, what do you think about
I think you froze up again right at the question, but I'll assume the question is, like, how many times can you get an RFA, and what is the time frame in between? Is that correct?
yes, how often can you do an ablation?
So again, these are supposed to have longer term effects, and they're supposed to last on the order of 3 months, 6 months to a year. So in general, most times you can have an ablation 2 to 3 times per year, and in order to continue to have pain relief. If that's becomes more frequent than that, then that may not be the best treatment for you to undergo.
Thank you for that. We do have another question from Deborah, and it is, what if your scoliosis fusion new pain?
I'm sorry, can you repeat that again?
Apologies. What if your scoliosis fusion created a new pain?
Yes, that can happen, and that's actually one of the areas that I'm looking into. Not just scoliosis, but sometimes people have had a lumbar fusion or a lumbar laminectomy, and they may do okay for a while, but develop a new pain. And part of that, what I've been looking into, is the sacroiliac, because oftentimes we can stress that joint with the surgery in the lumbar spine. And so your pain may be due to that. So it may be beneficial to see your pain doctor or your rehab doctor to see if they agree. There's some physical exam test that can be done, as well as you can receive an injection into the sacroiliac joint. And if that helps improve your pain, it's a strong sign that that may be a cause of your pain after a scoliosis operation.
Thank you. The next question we have is from Corey as well. And the question is, do you have any thoughts on people who have back pain due to suspected CCI where PT doesn't help?
I'm not sure I understand CCI.
Craniocervical instability.
Okay, so you're talking about neck pain, is that correct?
In the question, it says back pain.
Okay. Well, craniocervical instability is a generalized term for people who may have some ligamentous issues with the where the spine meets the base of the skull or the cranium. And oftentimes this can result in some people having neck pain. And I guess it can translate into back pain if you have to compensate for your neck issues by either standing in a different position or adjusting your position while sitting into a way that puts abnormal strain on your lower back. So one of the things that I always look for in patients is their overall spinal balance and spinal health. And this is not just a picture on an MRI or just a one-time snapshot. This is looking at how a patient stands, how they feel when standing in relaxed mode. Are they able to stand with their head above their neck, above their back, above their feet? Because that's how we naturally stand. If we have to stand 2 pitch forward or 2 pitch back or 2 off to the side, it often creates problems that can result in significant lower back pain. So overall, I think a look at your overall spine health and the balance can help you if you have this problem.
Thank you, Dr. Fu. The next question comes from Stephanie, and the question is, can sacroiliac pain be helped with a spinal cord stimulator?
So in general, lower back pain can be helped with a spinal cord stimulator. If we do really think that it is from the sacroiliac, oftentimes the pain doctor will management doctor or the physiatrist will try another technique to try to relieve that pain so you do not have to have the spinal cord stimulator. But if those don't work, a spinal cord stimulator is a good option. Again, the idea is that it blocks the pain signals from your lower back from reaching your brain and then being processed into pain. And that is the goal of that. So yes, it could potentially be treated.
Thank you. The next question we have comes from Deborah, and comes from Deborah, yes. And the question is, does SI fusion limit mobility?
So that's a very good question. The idea of fusion does limit mobility in most fusion surgeries, and that would be a lumbar fusion in general. Because what we are trying to do is limit the motion that that segment is doing, because often that has abnormal motion and that results in pain. But the sacroiliac joint is a different type of joint. It's less of a joint like your elbow or knee joint, which moves, and more of like a joint in carpentry, which joins two pieces of wood together in a solid foundation. And so the sacroiliac joint is really not meant to move a significant amount. So if it's fused, what it does is it sort of stabilizes a unstable joint and does not usually result in any decreased level of mobility.
Thank you. Another question we have, it comes here from Jessica, and she is looking for your recommendations on who to go to for initial evaluation of back pain. Could this be a pain medicine doctor or a specific specialist?
Well, you can always see any doctor, and hopefully if you came to the spine center, either Lower Manhattan or Uptown, you would be directed to the best physician for your problem. But oftentimes, if you have a good relationship with your primary care doctor, that's actually a good place to start. If you don't have a primary care doctor, it may be a good idea to start either with a physiatrist or pain management doctor who is involved in sort of a multidisciplinary center. But again, I think primary care physicians often can help you navigate other health issues which may be impacting your lower back health. And so it's always a good idea to start there. Again, if you don't have a primary care doctor or they're not working currently, then definitely calling the spine center and getting a visit with one of our specialists is a good way to start.
Excellent. And we have a question here from Tay, which asks if you could elaborate on some of the causes of groin pain. I believe you mentioned it briefly. Sure,
that's a great question. In general, groin pain can be caused by a number of factors. It could be something like a hernia, especially in men, and that may be a non-lower back issue. It can be often related to hip pain, and hip pain definitely manifests with referred pain to the groin. And then finally, it can be related to sacroiliac pain or pain coming from the sacroiliac joint. In general, groin pain doesn't come from the lower back. That usually results in hip pain or leg pain, but less likely groin pain.
Thank you. A question from Patricia is, what is the treatment of choice when there is and I'm going to butcher this here, listhesis of 15S1?
Sure, I think you mean spondylolisthesis of L5 and S1. And that's a very common problem. And in fact, I showed an x-ray of that earlier as a potential cause of lower back pain. And that is a structural abnormality where one of the vertebrae, L5, is not aligned with another, which is S1, or the bottom of your spine. And that can result in significant pain. And there are often different treatments for it depending on the severity of the spondylolisthesis and the cause of it. Spondylolisthesis can be caused by a number of factors. Arthritis is the most common, where there's degenerative spondylolisthesis. The joint becomes unstable and starts to loosen. It can be due to fractures. Often these are fractures in young people from jumping. We see these in cheerleaders, acrobats, gymnasts. from landing on their feet in repetitive ways, and this can result in spondylolisthesis. It can be related to other things like severe trauma in a car accident. It can be related to tumor or infection. But in general, most times it's related to arthritis, and the treatments are similar to other treatments. We try less invasive treatments first. If it becomes more severe and there's compression of the nerves or potential cause of damage to the nerves that run to your legs or bowel or bladder, you may need a surgical intervention.
Thank you. And we have time for 2 more questions here. So this one comes from Lester, who's curious on your opinion of IDD, Peter decompression therapy for spinal stenosis.
I'm not quite sure I understand those, the letters there, what they mean. I don't know that one without probably the words.
Yeah, it isn't spelled out, unfortunately.
Okay.
We will, Lester, if you can type it in the chat box, and if we have time, we'll come back to it. Another question from Lawrence is, what is the best approach for cervical pain caused by arthritis?
That's a good question. They're very similar to back pain in the sense that, there are joints in your neck, and your neck health is very related to your overall physical health and your muscle health. So again, I think with neck pain, the first thing to do is to check for what the causes may be. Number one cause of neck pain, it sounds kind of silly, but it's stress. And when you have stress, the muscles in your neck can be quite ready to spasm, and they can cause a significant amount of pain. So dealing with that is the simplest way to decrease neck pain. But if there's a structural issue, you go down the very similar pathway of speaking with your doctor about maybe other medical conditions. And if those don't seem to come to play, of getting either an MRI and then starting on physical therapy and seeing either a pain management doctor, or if it's very severe, a surgeon.
Thank you, Dr. Fu. And Lester did clarify on this last question, if you're able to provide any thoughts on this. So it was IDD therapy, which is computer decompression of the spinal column. Do you have any thoughts on this?
Yeah, I don't know that one. I've definitely never practiced with it. My guess, and this would be a guess, is that it's related to sort of a small procedure using either a computer or a small device to affect decompression. I don't really have enough experience to be able to say if I've seen it work or not work in patients. And I think that would be probably a very specific question toward a technique that may be used by probably not the average practitioner or pain management doctor.
Thank you so much, Dr. Fu. We appreciate your presentation and response to these questions. I will turn it over to Alicia for final thoughts.
Yes, thank you, Dr. Fu. Again, everyone, if you'd like to schedule an appointment, we have the number listed here. I'm just going to go ahead and play a quick slide on our telehealth, just to give everyone a better idea on how we're extending our services to you during this time.
I don't think the sound is playing.
Was it playing at all?
I don't believe
How
so.
about now? Is
No.
it playing? No? Okay. Unfortunately, it's not showing here. Anything yet?
No.
Okay, everyone. So we're just gonna have to circle back to you. I can hear it loudly on my end. I'm not sure why it's not playing on yours. Again, we want to thank you so much for joining us. Please keep your questions coming. And again, this is the phone number here if you'd like to schedule an appointment with us. Okay, I'm going to go ahead and close the webinar, but thank you so much.
Thank you.